Hello, my name is Professor Sanjay Pandanaboyana. I'm a liver and pancreatic surgeon at the Freeman Hospital in Newcastle, and I also undertake private work at the Nuffield Hospital in Newcastle. And my other area of specialization is general surgery, which would include management of gallbladders and hernias. I've always been passionate about undertaking surgery, even during my early career as a medical student. I've been very fortunate to have some very good mentors who are excellent surgeons, and when I watch them operating, I've always thought, that is what I would like to do. And also, what I've realized is, as a surgeon, the results you see from operating are pretty instant. You operate on someone today, and then within 2 or 3 days, you see the results. They get better, and they go home or move on to the next phase of their treatment. And that is other aspect of surgery which has always made me to develop interest in surgery, and that is why I wanted to do surgery, and that is what I love about surgery, is the fact that you're able to help people and patients, and you can see the results quite quickly. The most rewarding aspect of my job, whether it's cancer surgery or benign surgery, is to be able to see people get better quite quickly and move on with their treatment. But if it's for cancer, the most important aspect is for them to get their operations and then move on to chemotherapy, which is what's going to prolong their life. And when it comes to benign surgery, say for instance, gallbladders and hernias, the most important aspect for benign surgery is to get patients to their uh, pre-existing quality of life, because sometimes you often underestimate the impact benign problems like gallbladders and hernias can have on patients' quality of life. And what's most fascinating for me is to see when I operate on these patients, when I see them back in the clinic in 3 to 4 weeks' time, the pain is completely gone, whether it's from gallbladders or hernias, and they're able to get back to their normal activities, and they've regained their quality of life, which is the most important aspect, both for the patients and for me. When patients come to see me, they can expect best quality of care based on current evidence. Apart from being a consultant surgeon, I'm also a researcher. I'm a professor of surgery at Newcastle University. And one of my other jobs is to make sure the treatment I offer to my patients is based on current evidence. So when they come to see me, I'll make sure they get the treatment based on the best possible evidence, based on current evidence, based on the data published in the literature. The second aspect is to be able to provide them personalized care. Not all patients are the same. Not all patients have the same level of fitness or pre-existing medical problems. So I'll make sure the treatment I offer them and the recovery pathway they will be on will be dependent on their pre-existing medical problems, their age, and their fitness levels. And I will make sure I personalize the treatment I provide to them based on their pre-existing medical problems and what their needs are.